Within the first minute of life, your precious newborn is getting chest compressions and their lungs deep suction. How could this possibly be happening? Today, I'm going to talk to you about why vaginal birth is a better option than a cesarean section delivery. As stated in Labor and Delivery, Childbirth the Basics, 70% of babies are born by vaginal delivery, which is defined when the baby comes out of the vagina. Not surprisingly, vaginal deliveries have been the most common way to deliver a baby because of the options and advantages. For example, a mother has a choice whether to have a birth plan, which position to deliver the baby, who is in the room during delivery, and whether to use pain medication such as an epidural or have a natural delivery. A major benefit to delivering vaginally is being connected with the baby instantly. Once the baby is out, the mother is able to see the baby and hold the baby right away. This allows mother-baby bonding. Also, mothers can breastfeed immediately. As for mothers' bodies, the healing process is usually 48 hours, and a plus point, there's no surgical scar. Now that we have learned about vaginal birth, let's learn about the surgical way to deliver a newborn, which is called a cesarean section. Vincenzo Bergella describes a cesarean delivery as a surgical procedure used to deliver the baby in the journal C-section Cesarean Delivery Beyond the Basics. The surgical procedure requires an anesthetic and 2 incisions, 1 incision in the lower abdomen and 1 in the uterus to remove the baby and the placenta. In the United States, more than 30% of births occur by cesarean, and is sometimes the best option for delivery. For example, when the mother is carrying more than 1 baby, such as twins. Another situation is when the mother has an STD or communicable disease. The most common types of diseases are HIV and herpes. A cesarean delivery avoids exposure of disease to the baby. Lastly, any complicated pregnancy should be delivered by cesarean so the baby can be removed rapidly if needed. Having any types of surgery has its drawbacks though. Compared to a vaginal delivery, the healing process is much longer, usually up to a week compared to only a few days. With any surgery, it has its risks such as infection, bleeding, and in this case, injury to abdominal organs. Another negative aspect is the mother is going to be left with a surgical scar. Unfortunately, if the mother is given general anesthetic, this causes disadvantages and/or complications. The mother will be unconscious during the delivery and fail to experience the birth. Support from family and immediate friends and contact will be not allowed with a baby, phrased by Vincenzo Bergella in C-section Cesarean Delivery Beyond the Basic. The general given anesthesia is passed through the mother and affecting the baby as well. This can cause the baby to have respiratory problems. The baby has fluid remaining around his or her lungs, may not come out crying, and need immediate suctioning or CPR. Having a cesarean delivery can be the right choice based on circumstances. According to Vaginal Birth After Previous Cesarean Delivery, the reason for the dramatic increase from 5% to 31% over the last 37 years is because of the saying, once a cesarean, always a cesarean. In the journal, The Trial of Labor After Cesarean Delivery, TELAC, provides clear evidence that women can undergo vaginal delivery after cesarean with fewer complications. A vaginal delivery has less risk than cesarean section. Women who have a vaginal delivery avoid major surgery. For that reason alone, the risk of hemorrhage, infection, and recovery time are all reduced. A cesarean delivery should only be considered when absolutely needed. So think twice and don't slice.